Hello class, today we're going to be discussing the Affordable Care Act. This project has been put together by Deborah Anning, Bintu Gambala, Edwin Okutu, Melva Gardner, and Mikhail Patterson. The Affordable Care Act was introduced to us on March 23, 2010 by President Barack Obama. The purpose of this act was to ensure that the vast majority of the United States population had access to affordable health care. With the implementation of the ACA, millions of people were awarded the opportunity to gain health care access with the additions of more benefits as well. In this presentation, we will be giving an in-depth analysis of the ACA and the positive impact it has made. Who is newly covered? So roughly 19.2 million non-elderly citizens were estimated to gain health care coverage. Over 2.8 million children from ages 18 on up gained coverage. Roughly 5 million American women of childbearing ages 19 through 44 were also able to access health care coverage. And also, uninsured rates dropped over 53% in several states such as California, Florida, Michigan, Chicago, Ohio, and Wisconsin. So this is just a chart just showing how the ACA has improved and awarded healthcare coverage to millions of individuals over the past roughly 2 to 3 years. So how was the ACA achieved? So the ACA allowed states to expand Medicaid to all low-income families. It created subsidies for middle-class income families. It expanded both private and public health care to Americans. It provided coverage gains to all demographic groups, and it allowed for tax credits to be awarded. So the ACA provides strong evidence to opt in or out of the expansion of Medicaid eligibility. It develops and operates state health insurance exchanges. It also extends the Children's Health Insurance Program, which is also known as CHIP, and states are required to maintain income eligibility through September 2019. So what is health insurance? Health insurance is a type of insurance coverage that covers the cost of an insured individual's medical and surgical expenses. Depending on the type of health insurance coverage, either the insurer pays costs out of pocket and is then reimbursed, or the insurer makes payments directly to the provider. In the United States, health insurance marketplaces are also called health exchanges. There are organizations in each state through which people can purchase health insurance. These exchanges predate the Affordable Care Act and facilitate insurance plans for employers of small and medium-sized businesses. So the following three slides are just charts that, informs you guys how to apply for healthcare coverage through the marketplace. It is offered in all 50 states, with Massachusetts being the healthcare connector. Now, Vermont is a little bit different. Vermont has a state-run health insurance exchange and has long been a pioneer in healthcare reform. Initially, Vermont was planning to switch to a single-payer system as of 2017, but abandoned that plan in late 2014. More than 30,000 people enrolled in individual marketplace plans through Vermont Health Connect during the 2017 open enrollment period. Vermont is also one of only two states that has merged its individual and small group risk pools, and one of only a few states that has continued with the original plan to include groups of up to 100 employees under the definition of small group as of 2016. The state of Colorado passed legislation in 2011 to create the exchange, and is among 12 states, including DC, that are running their own exchanges and enrollment platforms for 2017. Although some carriers exited the Colorado exchange at the end of 2016, Colorado is still among the most robust exchanges in the country, with 7 carriers offering plans. The open enrollment period for the Affordable Care Act usually starts at the November the 1st of the year of and ends January 1st into the next year. So you generally have around 4 or 5 months to apply for coverage. Medicaid coverage before the ACA. Prior to the ACA, Medicaid was a program designed to cover medical services for four categories of the needy: the disabled, the blind, the elderly, and needy families with dependent children. Even with such coverage, quality care for the needy was non-existent. Medicaid and the ACA Amendment. To be eligible under the new Medicaid expansion, for instance, based on the chart, a family of three must be making below $26,800 per year. That is not even enough to cover the basic human needs of three, let alone to pay for health insurance. Facts like these explains why not only the need to use emergency rooms as doctors' offices, but also the increased number of the uninsured prior to the ACA. This table displays the federal poverty level requirements to be able to receive premium tax credits for the ACA. According to Dr. Martin, Pap smears, mammograms, and colonoscopies started getting done routinely. Depression and anxiety could be eased. Screenings for blood pressure, blood sugar, and cholesterol became possible, and the uninsured were getting better treatments through the expansion. How are healthcare premiums affected? The average premiums in the nation's individual health market dropped significantly in 2014, which was the year of the ACA took effect. The healthcare exchange offers subsidies, also known as tax credits, to those who qualify. This will help to reduce the amount of the monthly premium. People are getting more for less because the ACA declared that health insurance coverages offer more benefits. For individuals who decide not to take the tax credits towards their premium every month, they can receive them later in the year when they file their taxes and receive one large lump sum equal to the amount they were allotted by the exchange. This chart just displays how with the introduction of the ACA, healthcare insurance premiums dropped significantly over the past 3 years. Is the ACA a good or bad law? The goal of the ACA was to ensure that all individuals have access to health care. It eliminated medical underwriting, meaning individuals cannot be denied health care based off of pre-diagnosed health care conditions. It allowed that more individuals qualify for Medicaid and Medicare. It lowers overall health care costs, requires that health care plans cover the 10 essential benefits, and children under the age of 26 can stay on their parents' benefits. The middle class earning up to 400% of the poverty level can receive tax credits towards their premiums, and businesses with more than 50 employees must offer health care insurance. The Affordable Care Act, passed in 2010, is the sum of the Patient Protection and Affordable Care Act and the Healthcare Education Reconciliation Act of 2010. ACA made provisions on healthcare insurance reforms that expands and improves access to healthcare insurance programs. The ACA implemented health insurance reforms that expanded and improved Medicaid programs for all Americans. The aim is to provide a better quality of life by lowering health care costs, providing more choices, enhancing quality of care, and guaranteeing access to care for all. It also ended discrimination against people with pre-existing conditions and eliminated annual caps on benefits and lifetime limits. These elements are a major source of confusion on Capitol Hill, as the act's most enthusiastic opponents claim it. Socialized is medicine, meaning that the government has taken over the delivery of care. So there was a minor debate in reference to the ACA. Republicans say that the law imposes too many costs on business, healthcare providers, and the government. According to Hall and Lord, it is a misconception that the act puts the federal government deeper into debt because it is expected to cost about $1 trillion of federal spending over the first decade. Nevertheless, the law is designed to cover the federal government's costs through various tax increases and spending cuts, so it is not expected to increase federal debt for the foreseeable future, according to the Congressional Budget Office. The key provisions of the ACA are designed to increase access and reduce care costs, a main variable for policymakers. In the current administration, there have been failed attempts to repeal and replace the ACA. Government has a moral responsibility to provide affordable health care to all Americans. In closing, the ACA has proven itself to be very successful and beneficial to the United States population. Millions of individuals were able to receive health care benefits for themselves and their families as well. With the expansion of Medicaid, Medicare, the 10 essential health benefits, and subsidies that were awarded to those who were in need, we have seen very positive outcomes. Mortality rates have also been greatly reduced due to more individuals having health care coverage, which is extremely detrimental. Hopefully in the near future, we can expect to see more improvements within the U.S. healthcare system. This concludes our presentation. I hope you guys enjoyed.